Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today I'm here with Faris Ghawi of Vytalize Health. Faris, thank you for joining us.
Hey, thank you, Hall. Great to be here.
What was your background before joining Vytalize? What did you do before this?
So my background, I'm actually an engineer in background. I went to school for engineering and finance and was in real estate development. And my family did some real estate development as well as some healthcare in Jordan, which is where I'm from. Yeah, I was in healthcare consulting right before I started the company, worked at Ernst & Young and worked on a lot of the M&A transactions that were happening in healthcare and the telecom industry at the time.
So what led you to start working in the healthcare space?
Pretty coincidental, frankly. I moved to New York for my MBA at Columbia, and two friends of mine that I'd met at Lehigh in undergrad approached me. They're physicians, and they had an idea around starting a business around primary care and providing a better care model for seniors. And I thought they were onto something, and we got to talking and essentially started the company in 2014 and multiple pivots. And here we are 5 years later. But yeah, it was getting two physician friends of mine that I had met at undergrad.
Well, great. Well, for those investors out there listening, what's your advice for them about investing in this healthcare space? What would you tell them to do before they write that first check?
Well, I think for investors in the space or looking to get into the space, they may know that this is one of the most exciting times in healthcare. What's happened, Hall, is essentially the entire way that healthcare is being paid for is being transformed from what's called fee-for-service, which is paying for almost like on a menu for a service provided based on volume of services, to a payment model that incentivizes and pays for value, right? Outcomes. And outcomes are defined as both the quality of the healthcare as well as the overall cost of the healthcare and the efficiency of it. And this change has really kind of transformed the industry because there's now the economics are aligned, right? So if you're a technology or you're a provider and you're able to cut down healthcare costs, then you have some upside and you're able to share in that. And I think anybody looking at the space today from an investment standpoint should keep in mind that the name of the game today in healthcare is cutting costs and capturing savings and sharing savings and out of the value that's created in the system. So there's a lot of noise out there, a lot of good intended company, a lot of good solutions out there. You know, we see a lot of point solutions that probably don't have a great chance of kind of great adoption. There's a little bit of tech fatigue in the space today, I would say. But really, at the end of the day, if a business is able to cut costs, whether it's on a type of patients or a type of condition, and have a business model that allows them to capture that or a portion of those savings, I think that's the holy grail.
Well, value-based healthcare holds a lot of promise, and cost cutting is what it's all about. But what's the challenge of implementing a value-based healthcare program? That doesn't seem also easy to change the way people charge and pay for things like they used to.
Right, no doubt. I mean, one of the complexities in healthcare is just the multitude of stakeholders, right? So you've got the payer, the provider, the patient, the family member, and a lot of different parties that need to be aligned. One of the other challenges that we see is just one of those industries that's still very highly fragmented, right? And then different parts of healthcare are well consolidated, but there's still a lot of fragmentation. And that's not necessarily a bad thing, but it does create some challenges, right? So, you walk down the street, there's only 4 types of pharmacies, right? Walgreens, Rite Aid, CVS, Duane Reade, right? You walk around doctor's offices, it's really mom and pop doctor's offices all over the map. And so that creates a challenge for distributing and implementing things that have worked, right? The solutions for cutting costs and eliminating waste are really out there. It's not rocket science. The solutions are out there. It's just a matter of implementing them and aligning the economics of all stakeholders. And I think there's a lot of opportunity there. And I think what we're seeing is things are happening very, very quickly. And hopefully the industry will see a good, nice reduction in waste and spend in the next few years.
So how does Vytalize Health fit into the landscape of value-based healthcare?
So We at Vytalize are focused on the senior population. So we're predominantly focused on Medicare and Medicare Advantage as the payers. Essentially, Medicare is driving a lot of these value-based programs. They're trying to tie payments to outcomes. And a lot of this really revolves around the primary care physician. Just the way healthcare works, the primary care physician is really at the center of all of this because as gatekeepers, they're very well positioned to cut costs and manage patients and be much more involved. So Medicare is trying to incentivize primary care doctors to do a lot more and trying to align their payments with value-based care and sharing and savings. However, a lot of the independent doctors, and there's 100,000 of them today in the US, and they manage about 40% of the Medicare population, 1 to 5 providers in the practice. And so they lack the infrastructure, they lack the know-how, the financial capability to really transform their practices and participate in these programs with Medicare, even though there's a tremendous opportunity for them financially and from a care quality standpoint. So essentially what Vytalize does is bridge that gap between primary care providers and Medicare. And we partner with the primary care providers to upgrade their practices and allow them to participate in these programs. And it's a one-stop solution. It's technology, it's people, it's know-how, it's relationships. It's really putting all that under one package so that it's easy to digest for a physician that's working day and night, spending too little time with the patients because they can't afford to, and they're really starting to get frustrated. So our goal is to show them sort of the opportunity with Medicare, bring them into the game, and really have a win-win for them and the patients and Medicare.
What kind of cost savings can someone realize with these types of solutions?
So a lot of different opinions on this and studies done, but roughly speaking, we believe there's about a 10 to 15% clear waste in the healthcare system. The average Medicare patient costs Medicare around $10,000 a year. About 1,000 or 1,500 of that is really waste that can be eliminated with proper systems in place and proper tech. And so this is what we're after. Vytalize, we're doing this. We cut 13% of cost. 2018, we're targeting the same this year and hope to keep improving it. So, and we're not the only ones. I mean, there's plenty of accountable care organizations that have been able to drive these kinds of savings. And like I said earlier, the formula is out there. It's just a matter of pulling everybody together and putting the right tech and people in place to make it happen.
Are there particular sectors or subsectors of the healthcare industry that this works best for?
So it's since we're in the business of cutting healthcare costs and cutting waste, the senior population is the biggest spenders of healthcare, and so that's where we focus on. But chronic diseases and these conditions, they're not exclusive to the senior population. A lot of people in their 40s and 50s have these conditions. And so essentially the higher the spend, the higher the opportunity to reduce costs. That's where we focus on. But the problem is nationwide. I mean, it's global, but it's really nationwide, which is our focus. So it's the same story across the US. You see it all over the place.
And so how is it being perceived by the healthcare community? Is it being picked up and embraced at this point?
Yeah, we see that. We see that a lot. I mean, just to paint a picture here. So the way Medicare has decided to push through these value-based payments is through a structure called an ACO. And an ACO is essentially an entity that groups providers, whether it's physicians or hospitals, and contracts with Medicare on a shared savings program. There's about 500 ACOs in the country today. About 30% of them have been successful in achieving savings. And what's really interesting is you're seeing a lot of consolidation, or the seeds of consolidation, I should say. It's really early, but the successful ACOs want to grow. They want to take what's worked for them and deploy it across other areas. And some of the genius in the regulation, the way Medicare has done it, is really incentivizes the successful ACOs to continue to grow. You're essentially competing against yourself. Once you're cut costs in a certain area, it becomes harder and harder to achieve savings. And so the ACO is encouraged to grow and go into areas where the efficiencies have not been achieved yet. So I think you're going to see very exciting things happen in the Medicare ACO market and other ACOs in general. Successful ACOs really standing out and growing and a lot of consolidation. So it's a new industry. It's 7 years old, but I think it'll consolidate quite rapidly. And that's where Vytalize comes in.
So what's the next stage for Vytalize Health? Where are you going from here? What's coming up next?
So we're currently in 9 markets, where our main markets are New Jersey, New York, Texas, Louisiana. We've expanded to 5 new markets. Our goal is to continue to deploy our successful model within the markets we're in and expand to other markets and really just deploy the solution that has been proven to work, that is better for patients, better for Medicare, better for the primary care doctor, and is just struggling to see the light because of all the complex regulations and complex different stakeholders in the system. So our goal is we own our own ECO. We're in the process of launching a few more ECOs, and our goal is to deploy this on a wider scale.
Well, it sounds like it's going very well and it's being embraced broadly. In the last few minutes that we have here, what else should we cover that we haven't?
I think there's a lot of people that are intimidated by healthcare. I think once you get into it, we encourage people to get in and learn about these different programs out there. It's really exciting stuff. I mean, I didn't come in from a healthcare background and been in it 5 years, and you'll quickly kind of pick it up and understand the opportunity here. It's a very exciting, very big problem to solve, and that's what gets me out of bed every morning is to deploy the solution on a wide scale. And I think if we're to touch on politics a little bit, I think there's a lot of lessons learned from the new healthcare model and Medicare shared savings program into other sectors where really you're able to show how aligning economics in the right way and can have really substantial benefits to everybody involved. We can see this happening in the energy sector and many others. So good model to dive into and understand. And it's one of the few models where there's real bipartisan support.
That's great. So how best for listeners to get back in touch with you?
I'm available. I'm open. Always happy to chat. LinkedIn, email. Feel free to reach out. Vytalize is always looking to partner with the best of breed digital health solutions. So if you've got a technology that you believe is able to cut costs for some reason or improve outcomes for patients, please reach out. We're always looking to partner with the best out there. And, we move quickly. So please reach out.
That's great. We'll put those in the show notes. Want to thank you for joining us today and hope to have you back for a follow-up soon.
Sounds good. Thank you so much, Hall. Great chat.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.